Hello. Thank you for tuning in to our virtual presentation. Trigger warning. Active shooter training for the emergency department. My name is Joshua Mchugh. I'm the Simulation Fellowship Director for the Mount Sinai West Emergency Department. I work along with Heidi Baer, the Simulation Division Director, and Dan Satnick, Sim faculty member. Thank you to SAEM for the opportunity to present our project. In 2019, there were 417 mass shootings in the United States. A mass shooting is defined as an incidence of gun violence that results in 4 or more victims, excluding the shooter. Mass shootings have occurred in schools, places of worship, concerts, and hospitals, among other settings. In 2017, a physician entered Bronx Lebanon Hospital where he worked. Armed with an AR-15 under his white coat, he killed 1 person and injured 5 others. Because of COVID, mass shootings are down this year, but as states reopen, there has been an increased incidence of gun violence. There has been 154 hospital-related shootings between 2000 and 2011. How can we be prepared if there's ever an active shooter in our emergency department? During this presentation, we will review the active shooter simulation at Mount Sinai West, discuss implementing a process to respond to active shooters, and discuss ideas to keep patients and staff safe. I have no financial disclosures. This project started when teaching medical students what to do if an active shooter presented in their school. Some students hid under the desk as there was only one door to the room we did the sim in. As you can see, one student tried to run out of the room and quickly met his fate, a second shooter. To implement this project in the emergency department, the simulation division created an active shooter curriculum. During the training session, which occurred during an ED shift, there was a pre-brief, simulation, debrief, and planning session. In addition to the typical simulation pre-brief consisting of the basic assumptions, participants were informed that an event was going to occur during their shift. They were also offered an opportunity to excuse themselves if they felt simulated violence could be a potential psychological trigger. Staff then returned to their respective duties. Then an active shooter presented with a Nerf gun and randomly shot at staff members. This is one of my former residents. At this time, I'd like to note to the aides at GME that no residents were harmed during this simulation. After the simulation and assessment of victims, the team gathered for a debrief. There were 15 participants. However, only 11 turned in their pre- and post-surveys. Pre-simulation, 2 out of 11 knew how many exits there were for the ED. After the simulation, 10 out of 11 knew all the exits for the ED. 82% of participants reported learning to be more aware of their surroundings in the ED and strategies for dealing with an active shooter. Nearly 50% of participants learned run, hide, and fight. 4 participants had prior active shooter training. If there's an active shooter, run away as fast as possible. Stay low to avoid bullets and be as silent as possible. If you cannot run, hide. Hide in the medication room or supply closet. In many places, these rooms are locked and non-employees cannot access them. Also consider the soiled utility room or under your desk. If you cannot run or hide, you should fight. Give yourself a chance to live. Use anything you can as a weapon. In the ED, consider using sharps. Attack sensitive regions to impair the attacker. The goal is not to kill. The goal is to injure enough so that you can get away. Your department can put structures and systems in place to keep patients and staff safe. Consider installing metal detectors or having metal detector wands available for your security officers to use. You can limit access to the emergency department by installing ID card access scanners. For those who are building new emergency departments, you can consider installing bulletproof glass in doors. Of all the ideas to implement, it's most important to have a plan. Mount Sinai West has a cold silver alert system, alerting staff to an armed intruder. Hospital response includes contacting 911 and hospital security, in addition to emergency and disaster management and public relations. This policy also includes the concepts of run, hide, and fight as described by the FBI and Department of Homeland. Code Silvers also include an all clear signal to alert staff when it's safe to return to patient care duties. Some of the limitations we had with this project is that projectiles from a Nerf gun do not have the speed of bullets from a firearm, which limits the amount of casualties that can be demonstrated in a simulation. Additionally, participants were warned of an impending event. In actuality, assailants rarely give warning of an impending mass shooting. Furthermore, standardized patients were not involved in this project. Moving forward, future active shooter simulations can include standardized patients for higher fidelity of simulation. Additionally, we can include more hospital security and invite local law enforcement to participate in this drill. These are our references. Thank you for your attention. And again, thank you to SAEM. If you have any questions, please contact joshua.mchugh@mountsinai.org.